Hospitals and surgery. Today, some people go to hospitals to get well when they're ill. In the past, some hospitals were so bad that they make ill people worse. Hospitals in the past. From about 1,000 years ago in Europe, monks and nuns cared for patients in hospitals. They weren't doctors or nurses, and they didn't cure their patients. They gave patients food and a bed. They said prayers with them. The worst disease at this time was the plague. Monks and nuns cared for many patients who had the plague because the patients had to stay in the hospital until they died. The plague killed millions of people in Europe and Asia. From about 1,000 years ago in the Middle East, there were many hospitals. There are lots of doctors and nurses to care for the patients, and they made medicines for the patients too. Doctors treated everyone who came there, and they taught new doctors and nurses about disease. These hospitals had different wards for different diseases. There were also pools and fountains because doctors believed that the sound of the moon water helped the patients to rest. Discover. Some hospitals in the Middle East had musicians and singers. They tried to make patients happy. Early surgery. Surgery is when surgeons cut open a person's body to take out repair or replace parts. From about 1,000 years ago, barbers started to do surgery. People go to the barber shops where the barbers cut hair. The barbers also pull out sort of teeth, treated wounds from fights, and cut off arms or legs that were badly wounded. Discover. In the past, barber shops had a red and white pole outside. The red and white pole stripes were a symbol for blood and band-aids. Anesthetists. From about 1,000 years ago, doctors in the Middle East started to make anesthetics. Anesthetics are drugs that stop a person feeling pain. Before addicts, people feel a lot of pain when they had surgery. Doctors made early assistant anesthetics for plants. They made some plants into medicine for patients to put in their mouth. This stopped the pain when a barber pulled out a tooth. Later, new anesthetics make patients go to sleep before surgery. When they woke up, the surgery was done.